In tetralogy of the fellow, 4 related heart defects change the way blood flows to the lungs and through the heart. Tetralogy means a combination of 4 related symptoms or problems. The 4 problems of tetralogy of the fellow are ventricular septal defect, pulmonary stenosis, right ventricular hypertrophy, and lastly, an overriding aorta. Ventricular septal defect is a hole in the septum separating the right and left ventricles of the heart. The septum normally acts as a barrier that prevents blood from both sides of the heart from mixing. But when there is a ventral septal defect, the high oxygen blood from the left ventricle and the low oxygen blood from the right ventricle can mix. This can lead to either too little or too much blood flow going to the lungs. Pulmonary stenosis is a narrowing or thickening of the valve that connects the right ventricle to the pulmonary artery, the blood vessels that carry low oxygen blood from the heart to the lungs. When in the lungs, blood normally soaks up the oxygen that we breathe and becomes oxygen-rich blood. This blood returns to the heart and then is pumped to the body. With pulmonary stenosis, the heart has to work harder than normal to pump blood to the lungs. There is also less blood traveling to the lungs because the pathway is narrowed. This leads to less blood becoming oxygen-rich. Right ventricular hypertrophy is a thickening of the muscular wall of the right ventricle. The thickened wall can contribute to blocking the flow of blood through the pulmonary valve, which allows blood flow from the heart to flow into the lungs. An overriding aorta is the artery that carries high oxygen blood to the body is out of place and arises above both ventricles, instead of just the left ventricle, as in a healthy heart. This allows some blood that is low in oxygen to flow into the aorta and out of the body instead of to the pulmonary artery, which would normally take it to the lungs to pick up oxygen.